Hi, in this lecture, we are going to start our study of the lymphatic system and immunity. Now, when we go over this system, it basically has two components to it. We will start with the lymphatic system, which is a series of lymph nodes, glands, organs, lymphatics, which are vessels. And you can see all these structures here in this image. Immunity is the biggest part of this chapter, where we really get into looking at what exactly is immunity, and we're really focused more at the cellular and protein level. So the lymphatic system, again, has a series of organs distributed throughout the body, and they're going to function for immunity. And immunity is defined as our ability to resist disease. So let's start with the lymphatic system. Why do we have it? Well, number one, lymphatic system helps make and distribute lymphocytes. So remember, we had leukocytes, which are white blood cells, and then we have lymphocytes. And the lymphocytes were the T cell, the B cells, and those NK cells. So these are the types of lymphocytes, and we'll be studying these in more detail. Well, number two, pretty important function. Remember that when we talked about blood flow through a capillary bed, we said that the hydrostatic and osmotic pressures, like those net filtration pressures, were not equal. And so we always lost more fluid than we were able to pull back into the venule. And I told you it was about 3.6 liters every single day. Well, that 3.6 liters of fluid, right, it goes out in your interstitial fluid, that has to be pulled back and returned to your bloodstream. And the lymphatic system, this is one of its main jobs, is to prevent all that edema. So it returns all that excess fluid. And then number three, it actually helps transport some hormones and nutrients. In fact, lymph is white because lymph is one of the main ways that we absorb fat in a meal. And so lymph is very fatty, which is why it looks white. So if we look at the structure of lymphatic vessels, you can kind of think of it spread throughout the body like your arteries and veins, but there's some big differences between those for the lymphatic system and our cardiovascular system. For one thing, it's a one-way system. Remember that we had the arteries that are always carrying blood away from the heart and the veins return it to the heart. Lymph flows one direction only. Lymph only flows back to the heart. We have lymphatic capillaries. And then we have lymphatic vessels, and sometimes they're just called lymphatics. Now, lymphatic vessels are going to be most similar to veins because we don't have a pump, right? We had a pump for our cardiovascular system, but there's no pump for lymph. So we'll be talking a lot about how does the lymph actually flow in such a low pressure system. But then we have some other words you haven't seen yet. We have this lymph, which is the fluid, is going to move from capillaries to these lymphatics, which are kind of like veins, but then it flows into collecting areas called trunks. So we have major trunks in the body that collect lymph from areas, like larger body areas. And then trunks will dump that lymph into a duct, and there's only two ducts. So let's look at this flow. We start with the capillary. We know the capillaries are right next to those systemic capillary beds, so they're found right near them. They are more permeable than our systemic capillaries, and they have thinner walls. Now remember, they're right here because they need to pick up all that excess fluid and solutes that left the capillary bed. Now they're very permeable. If you look at the endothelium of the lymphatic vessel, there's actually these big gaps that can flow. So anytime the pressure is higher outside of the capillary, these little cells just open right up. They kind of overlap a little like shingles on a roof, and they open and so material can enter. Well, because they're so permeable, that's great because we want to pull back all that material, right, that left. However, because they're permeable, big stuff gets in. So it can pick up proteins, debris, bacteria, viruses, even cancer cells. In fact, your lymphatics are one major way that cancer cells spread throughout the body. But the good thing is that this lymph is going to take detours through lymph nodes. And lymph nodes are going to filter and clean all that lymph. So we have the capillaries. Their job is to pick up the lymph, and now they go through these lymphatics or lymphatic vessels. And these vessels, again, will be very similar to veins because they're very low pressure. One way they're similar is they have valves. Remember that the veins in our body, especially the lower extremity, had these valves, and they work the exact same way. They're just like the semilunar valves in the heart. So as the lymph moves up, when gravity wants to bring it back down, they close, and it keeps it at that level. We also know that we have what are called superficial and deep lymphatics. And so these are the lymph vessels. Notice they're right next to the arteries and the veins, by the way. But some of them are superficial and you're subcutaneous, and some are deeper. Now, the ones that are deeper, actually that arterial pulse, remember when your artery kind of expands and recoils, that can also help move lymph, by the way, a little bit. Now, the ones that are close to the surface, if they ever get infected, lymphangitis, you will actually see this red line. The red line is the actual lymphatic. It's just so close to the surface, you can see all that inflammation. This is not a good sign, right? It's an infection, typically, inflammation, something's going on inside that lymph. And so a lot of times you will probably be put on some sort of strong antibiotic to clear that up. So these vessels or lymphatics are collecting lymph, and you can see they're usually shown as green lines whenever you look at lymph. And notice again, they're distributed throughout the body. So they're picking up the lymph, and remember, it only moves one direction, back to the heart. So as they're moving back to the heart, these lymphatics will drain into a trunk. So trunks are just larger collecting areas that drain lymph from specific areas of the body. So we have a right and a left lumbar trunk. So these are going to pick up lymph from my lower extremity, right? My lower extremity, my hip and leg, it's going to come up from the right side to the right lumbar and the left to the left lumbar. I have an intestinal trunk. It's right here in the middle. That is going to pick up lymph from my digestive organs. Now, if we look at the superior end of the body, and we look up here, we have three other ones. So we have a bronchomediastinal. So bronchomediastinal tells you it's picking it up from the lungs and chest. Okay, so notice we have a right and a left. We have a subclavian. We have a right and a left subclavian trunk. So these are picking up lymph from my upper extremity. So that will all drain into either my right or my left. And then the jugular trunks are going to pick up lymph from my head and neck. So as the lymph is flowing back to the heart, those vessels drain it or dump it into trunks. And then the trunks are going to transfer that lymph into one of two ducts. So there's two ducts. There's a right lymphatic duct, and notice that only drains a small portion of the body, whereas the thoracic duct is the largest of the duct, and it drains the majority of lymph. So if we just look at this diagram, you can probably figure out which areas, which trunks are draining into which duct, but we'll go ahead and fill it out. So if you look at the right lymphatic duct, again, it's picking up from this area up here. So your right jugular, your right subclavian, and your right bronchomediastinal. So if we look, it's picking up the lymph from the right side of the head and face and neck, the right upper extremity, and the right chest. Now that lymph is going to enter this right lymphatic duct, and it's kind of hard to see in the picture. I'll try to use green, but the right lymphatic duct is right here. Try to darken that a little bit. And you might notice that it is right next to the right subclavian vein. And so once that lymph comes back to the duct, it's been cleaned and purified, and then that lymph dumps into the right subclavian vein, and that's how it gets back to the blood. Now, if we look at the thoracic duct, again, this is the largest, right, duct. Notice this one, it actually starts down in the abdomen as something called the cisterna chyli. So when I was showing you those trunks, and we were looking at the abdomen, notice if we were to follow, there's the left lumbar, the right lumbar, and the intestinal. If you look, you'll see how they all kind of lead into this like sac-like structure right here. That's known as the cisterna chyli. Now, if we follow that, notice it runs. That's the beginning of the thoracic duct. And notice it comes all the way up. And then as it runs up, these are branches of it, then it's going to receive lymph from the other three trunks. So the cisterna chyli is the start of the thoracic duct, and it runs all the way up. collecting our lymph from our trunks. And then once it gets up here, we see that our left subclavian, our left jugular, and our brachiocephalic are going to drain into that. So excuse me, I should have said bronchomediastinal. I was looking at the vein on my picture and not the trunk. So my bronchomediastinal, so from the left side of my chest, my left subclavian from my left upper extremity, and then my left jugular from the left side of basically my head, face, and neck. And then notice that this thoracic duct here is going to empty lymph into the left subclavian vein. So the lymph moves one way. It starts down at the capillaries, and then it flows into lymphatics, which drain eventually into trunks, which drain into ducts, which send it back to the blood. So I mentioned we don't have a pump. There's no pump for your lymph, right? We don't have a little lymph heart. So it's very, very low pressure. And so we need to just talk briefly, how does it move? Well, I mentioned the arterial pulses. So some of them are right next to arteries. So when the artery recoils, it pushes it. We know that skeletal muscle contractions are pretty important. When you exercise and muscle contracts, it squeezes on the vessel and helps circulate it. We also know breathing works, just like it helped move the blood, inspiration and expiration, the diaphragm changing its shape will also help move the lymph. We know the valves are also important. The valves, just like in the veins, prevent the backflow of blood. We even know that things like massage can help push and help circulate lymph. And you might have like compression socks or compression garments to try to help, keep the lymph moving. Now, if it can't move, it becomes a lot of edema, right? Because it's picking up all that extra fluid. So lymphedema could be if there's a blockage in drainage. So something's not allowing it to drain, or there's a problem with this lymph transport. So you can obviously see that this right forearm is very, very swollen because of the lymphedema that's occurred. And this interferes with the lymphatic system function because you're trying to move the lymph back and clean it. And now it's just kind of stagnant there. So it is important to try to help lymph circulate, right? Massage, etc. would help. When it's stagnant, though, then you can have more infections. So, if there is an area that is like very diseased, like I'm thinking if you have maybe like a lower limb or a foot that has some gangrene, in that instance, you probably would not want to circulate it, but normally we want to keep our lymph circulating. So as we go through this system, we're going to be talking about cells and proteins, and just a few real quick reviews. We know that the tissue is reticular. You might remember reticular connective tissue from A&P1. It's just this network in lots of spaces, and we'll have a lot of lymphocytes. So we already said the lymphocytes are the white blood cells. We're going to have a lot of phagocytes as well. Remember, phagocytes are going to eat up things, and there's a certain cell coming up. It's called a dendritic cell. And you'll see it says APC. That stands for antigen presenting cell. So these are cells that are really important, especially for our T lymphocytes or T cells to work properly. This picture shows reticular cells. Not really too concerned about that. But also remember that we have our basophils and our mast cells, because those will also come back. If you remember that we had the basophils or mast cells, they are important for inflammation because they're going to release histamine and heparin. And then also, just a real quick shout out, remember the other phagocytes you already learned, the other white blood cells? These were like your neutrophils and eosinophils. So don't forget them because they're all coming back in this unit as well. Now there's special tissue called MALT, or you'll see it called GALT. It just depends on who wrote the book. Mucosa-associated lymphatic tissue, or they'll call it G for gut. Same thing. All this is special clusters of lymph nodes in certain areas of the body. So you want to have a lot of clusters of lymph anywhere you have an outside opening to help protect you from the pathogens outside of your body. So like the respiratory, digestive, and urinary tracts. What you're looking at here is two things. You're seeing something called, Peyer's patches. And Peyer's patches are located in the distal portion of the small intestine, and that portion is called the ileum. So the ileum of the small intestine, you can see it here, it actually is going to meet up with the cecum of the large intestine. Well, we know that the large intestine has a lot of bacteria in it. In fact, fecal matter is a lot of bacteria. And so whenever the material moves from the ileum into the cecum, there's a sphincter there. And when it's open, there's a chance that bacteria can back up or get into the ileum. So the ileum has these clusters of lymph tissues, looks like circular patches, and they're called Peyer's patches. So they protect the ileum from the bacteria in the large intestine. And then we also have that little thing that always looks like a little tail on the models called the appendix. And the appendix is actually kind of like a little biofilm. It has a lot of bacteria in it, but they're good bacteria. So we have some of that tissue here. The other one I know you've heard of are your tonsils. So we know when we open, say, that we have this special type of tissue. There's actually 3 sets of tonsils. There's the pharyngeal tonsils, which you might know as the adenoids. They're way up here in your nasopharynx. The palatine are the ones that when you open and say, you see them on either side of your oropharynx. And then the lingual, you have to push the tongue down to see that. So there's 3 sets of tonsils that are there to basically protect our respiratory and digestive tracts. Now, I mentioned that as this lymph is flowing back to the blood, it goes through many, many lymph nodes. So these little nodes are kidney bean-shaped structures, pretty small. The lymph flows through many of them, like hundreds of them, before it's allowed to return to the blood. And so their job is to filter and purify it. So it's been estimated they receive that by the time it gets back to the blood, 99% of all the antigens have been removed. If we look at a lymph node, it has 3 parts to it. It has a capsule, which is the outer portion that just surrounds the whole node. And then it has a cortex and a medulla. And these lymph nodes are packed full of cells. So in this picture, you can see the cortex kind of has these circular structures in the outer, and the medulla has a little more space. You do not have to memorize where the T cells or B cells are, but look at this list of cells that's inside a lymph node. So as lymph flows through the node, it's going to come into contact with the dendritic cells, the little APCs, macrophages, T cells, B cells, plasma cells. So as that lymph flows through, it's going to be cleaned up. Now, the other thing that's interesting is that you have these afferent vessels. And so the afferent vessels are bringing the lymph in. So lymph is going to enter through afferents, and then it leaves through efferent, which remember I will say is efferent, so you know what I'm saying. But notice that there's many afferents and usually only one efferent. Well, this is good because what happens is if as lymph comes in and it's only drained by one, it's going to force it to hang out in your lymph node longer. So as it flows through the cortex, through the medulla, and then it's going to be cleaned up. And so when it leaves, it's got lots of time in there. Now there's lymph nodes all over the body, but there's a few clusters we can actually palpate. So we have them in our groin, our inguinal lymph nodes. The mesenteric you can't really palpate. They're in your abdomen. You have some in your axilla. And you have some cervical, and you also have submandibular. And the submandibular are right under the angle of your mandible. These are the ones you might palpate or notice that they're a little enlarged if you have a sore throat. Because what happens is they get bigger when they work. So if you do have any kind of infection, you might actually see them, or you can definitely palpate them. Here's a submandibular. They're usually painful and they're swollen, and it's just a sign that they're battling some sort of pathogen. So tonsillitis is when you have inflamed tonsils. If you hear lymphadenopathy, this is a chronic enlargement of lymph nodes. So it's normal for them to be a little swollen short term, but if they tend to be enlarged over the long term, it could be that it's a lymphoma and they become a secondary cancer site. So if you notice chronic enlargement, over several weeks or months, then you might want to make note of it, and then it might be something that would get a biopsy. So the spleen we've looked at, the spleen is the little brownish reddish organ over on the left side of the body. It gets a little protection from your ribs, but it is the largest lymph organ. And while the lymph nodes clean the lymph, the spleen is the only lymph organ that cleans your blood. So it's very important because it cleans your blood. It actually does phagocytosis. It's one of the main places of phagocytosis for all those old, worn out red blood cells. When it breaks down red blood cells, it can even store some iron. It does sound the alert. Its job is to constantly be surveilling your blood. And if there's a pathogen in your blood, it triggers the immune response, especially those B and T cells. And your spleen can also store some platelets. So the spleen also has a capsule around it to protect it. And if you were to look at histology of the spleen, you would see these little islands, these little circular structures. This is called white pulp, and the red pulp is everything else. Well, the red pulp is red because it has a lot of that heme, because it's breaking down red blood cells. So it has macrophages, dendritic cells, it can do phagocytosis, but it also does phagocytosis and breaks down the blood. The white pulp is the area that has a lot of lymphocytes. So we do have the capsule, but we know that if we are sick, we know that we increase our white blood cells. And lymphocytes in particular like to hang out in your lymph nodes and your spleen. So if you have a chronic infection, a lot of times your spleen can become enlarged. And if it's becoming enlarged, then you're more likely, if you were to have a blow on the side, right, it might be protruding, so it might not get as much protection from those ribs. And so we do worry if there's a ruptured spleen, because the spleen gets a lot of blood. And so if it ruptures, there's always a risk of bleeding to death. So they'll do a splenectomy. Now, organs can regenerate. The spleen can regenerate. It regenerates quite well in a younger individual. So depending on the severity of the rupture and the age of the patient, if necessary, they'll remove it. Otherwise, they might wait and see if it actually repairs and regenerates. So if you have your spleen removed, it does do a lot of functions in the body, but you may be a little immunocompromised. So you might want to make sure that you get your vaccines all the time and try to boost your immune system as much as you can. But you can live without your spleen. And the last organ is the thymus gland. And you've seen pictures of this in lab because this gland is pretty much gone in an adult. So it sits right above the heart, superior to the heart. It's actually most active in childhood and puberty. And then as we age, it just starts to atrophy and shrink. And if you notice, the thymus gland is called the thymus gland because that is where your T cells are trained. So it makes a hormone called thymosin. And this hormone is critical for training your T cells. So it's thought that as we get older, our T cells don't work as well. And this may be one reason why the incidences of cancers tend to go up with aging. And it's just because that thymus gland just isn't working as well to keep your T cells trained. So this wraps up our lecture on the lymphatic system.